Relationship issues?
Relationship talk
On 702.
And on our relationship and sex feature this morning, we are talking about sex for men over 50. If you remember, a few weeks ago, we focused on sex for women over 50 because we know what happens to women's sex life when they enter their 40s. Apparently, it gets more exciting. That's the best time. But what about when they enter their 50s? Like, how do they keep their sex life going as women in their 50s? And that's what we discussed. You can go check out the podcast if you missed that conversation. And there are a number of men who are calling us and saying, yeah, but why are you only talking about women? Why are you not talking about us as well? Because we've got our own issues when we enter our 50s. So today, we are focusing on men over 50. Because when it comes to men's sexual health, turning 50 does not have to be the end of intimacy. It's natural for men, of course, to notice changes in their sex drive. Maybe you're noticing changes in your performance as you age, whether it's due to health conditions or, I don't know, medications, the stresses maybe of life. Those changes may include struggling with arousal. Maybe you are struggling with maintaining an erection or ejaculation. But as men age, the stress and the pressures of everyday life can also create a barrier to your sex life. But these shifts don't mean men must resign themselves to somehow a less fulfilling sex life. When you are over 50, you can still continue to enjoy rich and satisfying intimacy well into your later years. In fact, many older adults remain sexually active and they are still fulfilled, even in their 70s, 80s, and apparently even beyond, right? And it's more than just physical pleasure. A healthy sex life is both fulfilling and good for other parts of one's life, such as physical health and self-esteem. So we've invited someone who probably knows more about this, like more than any one of us, Professor Shingai Mutambirwa, who is a urologist and head of department at the Dr. George Mukhari Academic Hospital. Professor Shingai, welcome back to the show. Good morning.
Morning to you as well. And first of all, I must admit that your guests were very hot.
You can confirm?
I can confirm.
You can confirm that.
I can confirm.
Okay, so we spoke about women and sex in their 50s. And I have to tell you that I remember saying to my guest at the time, I was like, I'm so impressed. Like, there were lots of women who are in their 60s, 70s who were like, I'm having an amazing sex life.
Yeah.
And they've taken control. And I was so proud. I was so happy to hear that. And we'll hear with men, what they're concerned about. But let's start just with the foundational things. Does our sex life change as men as we enter our 50s? Like, does it get exciting? Does it start declining? What are the changes?
Okay, I'm going to start off by just stating that when you look at people's health, it's not about not the chronology, how old they are. It's about the way they are physiologically. For example, I've got some patients who are in their 80s and they look like they're 50. I've got some guys in their 30s who are looking like they're 60. And it's mainly because of a lot to do with our health and general, because remember, sexual health is related.
Like I'm 35 and I look 20.
You look less than that. It's just the beard, the paint on beard.
when I dye my beard.
That's true, but that's exactly the point. You can actually look at your peers and you can actually tell that isn't an issue. So, I think first of all, to make sure that you don't have to just accept age as a problem for anything, not only for your sexual health, but for every part of your health. But if we look at the data, as we're going to science, the so-called best sexual prowess for guys is between the ages of 18 and 22.
Which I find unfair because I'm probably not even having sex at that age.
Yeah.
Still trying to figure it out.
Well, a lot of people aren't, and that's the whole point. But I think I'll give you the physiology of that as well. The reason why we say that is because guys, unlike females, we don't get multiple orgasms. Okay, and orgasm is one of the major factors for a lot of people when they're having a relationship. Or
there's a difference between orgasm and ejaculation.
And ejaculation, right? Yeah. Now, orgasm is the feeling the ejaculation is related to orgasm. It's a mixture of the both. But the point is that when a female gets sexually stimulated, it's a little bit more of a plateau. It takes time. Like they say, an angry guy can have sex, but an angry woman will never have sex because they need to have the foreplay, get to the point where they get to a peak. And at that peak, they can then have orgasms, which are very similar to male orgasms. There are lots of muscles involved and stuff like that. And they can have multiple ones of those. Now, guys will say, oh, no, I've had multiple orgasms. But the reality is that when we get an erection, all that's happening is a lot of blood is rushing into our spongy tissues of the penis called the corpora. The blood is not allowed out. And when you have orgasm, whether you like it or not, there's a chemical called noradrenaline, which is released. It's the same similar to the chemical for fight or flight. And it squeezes down on your blood vessels and stops the blood going into the penis. Now, to get your next erection, you need to break down that chemical. And between the ages of 18 and 22, that could be a couple of seconds, maybe or less. And that's why some guys say, oh, no, I can have multiple. No, there weren't multiple orgasms. There were multiple re-erections to get orgasm. And unfortunately, as we get older, there's always going to be wear and tear. And if you're lucky enough to reach 80, the breakdown of that product of the noradrenaline can be up to 30 days. You see, so it's a little bit, that's where the idea that men's best sex is around that time comes from. And I would sort of contend, like you're contending, that that's not really true. I think we must remember that sexuality is not just about the biology, about the erections. It's about the social, the cultural, the physiological, as well as the personal feelings about sex. So I think we need to remember that all of these are going to make an impact on us. And fortunately, as we get older, often we start having different changes in our life skills. For example, when you're in a younger age, you're probably looking at school, you're rushing around, you're under a lot of pressure. You might have problems with your sexuality there. And similarly, as you get older, you're getting more relaxed, even as guys. You might find that you're more comfortable with your partner. You'll be more comfortable with your body as well. But I think one of the biggest issues for guys is that we often spend too much time trying to compare ourselves to other people of similar age or younger ages to try to make a determination of how our sexuality is. And I think that puts the impact. And I would really push that the biggest impact for guys over 50 is the psychology, the way they're thinking about their sex. Because the more you start stressing, oh no, is my penis big, or am I lasting long enough, or watching too much pornography? These things are going to impact. And I think we have to start recognizing that the psychological impact for guys, especially as we get a little bit older, can be positive or can be negative.
Okay. And what are the changes that normally people experience as they enter 50? And is it affected by that psychological aspect, like maybe, I don't know, you can't maintain your erection for too long, or early ejaculation, or struggling to whatever it is?
Yeah, unfortunately, all bodies are like machines. They do have their wear and tear, and for our purposes, the biggest impacts for sexuality are going to be for guys erections and the libido, the feeling for having sex. Okay. Now, if we break it down very simply, the erections, we've got their blood vessels which are pushing blood into the spongy tissues. As we get older, regardless of what happens, you can get some scars inside there. We call them atheromas, which are what causes heart attack, strokes, loss of limb, but also erectile dysfunction. And unfortunately, the penis artery is slightly smaller than the main one to the heart, which is slightly smaller than the main one to the brain, and that sort of thing. And so if you get a continuous problem with erectile dysfunction, that we usually say between 3 and 6 months continuously, you are at up to an 11 times increased risk of heart attack, strokes, loss of limb. And those scar tissues can be prevented, though. And it's your big 5 as usual. A bit of physical activity. Be careful with your diet. Not smoking. I'm not going to pontificate. The psychological stress. And then excesses of, for example, things like wine and beer, which is my forte. But the point is, all of these things can predispose you to things like high blood pressure, sugar diabetes. And sugar diabetes, high blood pressure, all of these things are not about sugar. They're not about diabetes. They're not about fat. It's about damage to the inside skin coating of your blood vessels, causing these atheromas if they get damaged. So again, the important thing for erections, at least, is to make sure that you live a relatively healthy lifestyle. Now, libido is mainly, for our purposes, it's psychological, but it also is very dependent on a specific hormone in our body, testosterone. Testosterone is produced mainly in our body from the testicles, and again, wear and tear. We know from the age of 30, there's a 3 to 5% decrease in testosterone levels as we age. and on year on year, and that can have its toll on the feelings of having sex, and that also then impacts on your erections. But also it impacts on the psychology. We know that if a guy over the age of 40 gets his first episode of depression, for example, 80% of them have a low testosterone, which if it's supplemented can actually improve their depression as well. So I think all of these things need to be related. But the thing is that it's a matter of integrating the different aspects of it, because if we just focus just on penetration and things, there are other aspects, for example, touching, feeling. Not having penetration is not the only important thing.
Tantric sex. Yeah, there's a lot. Yeah. So, okay, 011-883-0702. I want the gents to also share their experiences with us. Also, they are partners as well, because when we spoke about women and sex in their 50s, their partners were calling in. I mean, in heterosexual context, there were women, men who were calling in and saying, my wife is in her 50s and everything seems to be cool. Some were calling in to say, my wife doesn't even want to have sex anymore. What is your experience, right? Are you a man over 50? What is the state of your sexual health? What sexual challenges are you having? Are you struggling with your libido? Are you struggling with maintaining an erection or some ejaculation? Are you struggling with arousal? Or are you good and you're still able to do several rounds even at your age? It's 20 minutes after 11. We'll come back with your calls on 011-883-0702. WhatsApps on 072-702-1702. If you have a partner who's over 50, you want to share that experience with us as well, you're welcome to do so.
Relationship issues?
Relationship talk.
On 702.
23 minutes after 11 o'clock, we're talking about sex for men over 50. What are you struggling with? What is changing? What are you concerned about? What are you excited about? You can give us a call on 011-883-0702 or send your WhatsApps on 072-702-1702. Let's start with Tebogo in Hartbeespoort. Tebogo, good morning.
Good morning.
Sure. Go ahead, brother.
Yeah. I've got two problems here.
Yeah.
I've got what is called retrograde ejaculation, where the sperms don't go out, And I also have a severe erection nerve.
Mm-hmm.
Now, I would like to know if those two conditions are reversible. I'm 78 years old. I neither drink nor smoke. I'm healthy. I'm vegetarian,
Sure. Yeah. All right. Thank you, Tebogo.
Yeah, Tebogo. That's actually a very interesting question. First of all, when a guy ejaculates, what's happening is that your testicles produce sperm. They travel down through a long tube called the vas to the area of the prostate, which is sitting just below the bladder, all the way around the pipe for passing urine, which is also the pipe for ejaculation. And then because most of what a guy ejaculates is stuff made by that, things like sugars, proteins, and stuff which support the sperm outside the body. And for our purposes, there are two muscles around the prostate. One is below it, which controls so we don't wet ourselves. The one above it is used to push the semen forward when we have orgasm. Now, when we have orgasm, there are two aspects that happen. First of all, there's what we call emission, where all of these fluids are pushed into the pipe for passing urine. And then the second is when the ejaculation itself occurs, where you start pushing the semen out. And unfortunately, again, for guys, when we reach about 40, there's this prostate gland becomes a bit of a nuisance. It starts getting bigger. It can become cancerous and that sort of thing. And depending on what happens, for example, some medications we use to help to pass urine, because if it grows into the pipe, it can cause you not to be able to pass urine properly. A lot of those medications relax the muscle of that pushes the semen forward, and it can go back into your bladder and it gets passed out in the urine. Not dangerous or anything because it's just coming out there, but it can happen. Similarly, if we do prostate operations to remove the prostate or give radiation, it can do the same thing. So the short answer here is that if he's having a problem, the most likely aspect, if he hasn't had an operation or treatment for cancer or prostate, it's that the prostate is just a little bit larger. And there are some medications which we can try to use to help to push the semen forward. But I think, again, it's a matter of the mindset as well, especially if we can't do something about it. A lot of guys spend so much time thinking about it that it actually impacts on their erections and then gives them problems having sex in general. It's not dangerous. It's part of aging as well in a lot of men. But the thing is that you should get it checked out, and there are some things that can be used that might help. No guarantee might help.
Okay.
Yeah.
Adrian, you are in Johannesburg. Good morning.
Good morning, doctor.
Hi, Adrian. Go ahead.
Good morning.
Doctor, I'm 72 years old.
I've done, I removed both of my prostate. There was cancer in it, a rectal prostatectomy.
Yes.
There's no erections. The penis has started to shrink. I went to the doctor. We did testosterone levels is fine, he says. But I've got a problem. I don't know how to solve the problem.
Yeah. How long ago was the prostatectomy?
10 years ago.
10 years ago. Okay. Yeah. Unfortunately, when we have any sort of therapies for prostate cancer, the issue is that the main blood vessel and the main nerve that runs to make the blood vessels rush into the spongy tissues are right next door. They're like twins. They're like one on each side. And regardless of how hard we try to preserve them, any of these therapies can damage these blood vessels and the nerves, and that can cause exactly your problem. And I'm happy you're 72 and you're still looking to have sex. And I'll explain because there's good French data to show that if a guy over the age of 60 has sex twice a week instead of twice a month, you increase your longevity by up to 6 years. For females, it's 8 years. And so I always encourage any patient who's at any age, please do sex. Sex is a form of exercise. It's excellent stuff. Now, the mainstay of therapies for our purposes are going to be some medical ones and then some surgical ones. What the medical ones are, there are medications we call the PDE5s, which we often start to use early. These are the Viagras, the Cialis, the Vitras of the world, and all the generics, which are equally good, by the way, and they work very well. And using those can help because they also they help to relax the smooth muscle in the blood vessels and help to make the penis get better. But the point is they don't always work. So the next step is often to use what we call injectables. These are some things that they use a slightly different chemical, but you have to inject it into the spongy tissue before you try to have sex. It then increases the blood flow and helps with that as well. There are also things like we call Vacurect. These are not Vacurect, I mustn't use trade names, sorry, but penile pumps, which can actually suck blood into the area and help with that as well. And then there are other things which we're also using. There's a lot of newer stuff that's on the market, that's good, not in the market, but it's coming out soon, that are medical that can help in the future. But I think if you've been 10 years out, the chances of all of these, especially if the penis has shrunk a bit, because it can happen, particularly after the operation, is to consider going for a penile prosthesis. This is essentially an artificial penis, which we put some tubes into where the spongy tissues are and take out that area, and then we can pump up the area. And we can then whenever you need to have sex, you just pump in it, then fluid goes, you get a good erection. And there are also some which don't need pumps, which you then can move back and forth, and they're called malleable. All of these work very well, but I think you need to, even your testosterone level, it's an important thing, and there's a lot of drama about using testosterone in prostate cancer. The reality, there's absolutely nothing to be worried about for the vast majority of people. But the point is that I think you need to just talk to your doctor about possibly just moving forward, because a lot of guys don't do these penile prosthesis, but that is a very satisfying method of getting your erections back.
Okay.
Your urologist will do it, because I've got a doctor in Pretoria, urologist clinic.
Yeah, great guys, and they're some of the best surgeons for these specific prostheses are there. The issue is going to be about cost. It depends on, because the prosthesis itself is anywhere up to 100 grand or something, and the operation has to be done. But really excellent. But Pretoria Urology, like many of all the urologists in the country, they're excellent guys. You can definitely find help there.
Okay, Adrian, all the best. Just before the headlines, there was a question as well. Hi Clement, please can you ask the doctor there, does your penis shrink as you age? Because that's what I've noticed as I've just turned 60, and that's made me lose confidence during sex with my partner. Short answer is no. But the point is that your tissues can change, and in fact, some penises look larger as they get older, because the collagen gets more lax. But it's more about the erections, I think, and also the way you think about it, because often people think that there's an issue with their sexuality, and then when you don't get good erections, you think your penis is getting smaller. All right.
Relationship issues?
Relationship talk.
On 702.
25 minutes before 12 o'clock, we are having a conversation with Dr. Shingai, who is a urologist and head of department at the George Mukhari Academic Hospital. And we're really talking about sex for men over 50. We focused on sex for women who are in their 50s or have entered their 50s, over 50s a couple of weeks ago, and today we're focusing on men. And I'm asking what your experience is as a man who is over 50. What's your sex life like? Are you struggling with arousal? Are you struggling with maintaining an erection, maybe early ejaculation. How's your libido at your age, whether you're 60, 70, 80, or maybe you just have been cruising. You're having an incredible time. And Dr. Shingai, someone mentioned on Twitter that Clement, Viagra is the way to go when you have entered your 50s or you're over 50. Is that the case? And what are really the benefits of a Viagra?
Yeah, I think it's not the only way to go, but it is a very good choice. And we're using a trade name, but there are lots of generics of it. It's the chemical is called sildenafil, but there are other groups in this called the PDE5s or phosphodiesterase 5 inhibitors. What they're doing is they're relaxing the muscles around your blood vessels so that more blood can go through them. And so what they're doing is they're increasing blood flow, particularly when you're sexually stimulated to the penis. But because of that, they also have side effects which are sort of bad in some people, where you can get a bit of a headache, you can get flushing if you've got, and you can get palpitations. The reason why this is happening, though, is only because there's an increase in blood flow to the area.
Okay.
None of them are dangerous, and they always have what we call tachyphylaxis, where the more you use it, the better it gets. Again, you have to consult your doctor. There's two main things. You shouldn't be taking anything with any of these PD5s. That's if you're taking a nitrate. Those are those things in the movies where you see a guy having a heart attack and they put something on your tongue. It's helping to relax the blood vessels, too, and it's in the same class as the PD5s.
Okay.
So it can cause a precipitous drop in blood pressure, which can kill some people, and that's actually what happened to a famous politician in one of the African countries. The other one is not to, if you've had a recent heart attack or stroke or anything, because you shouldn't be exercising. But the reality is that all of these drugs, the PD5s, are super safe, super effective for the majority of people, 80-90% of people. And the nice thing about them is that we've actually published on this as well, that it actually can protect you from heart attacks, strokes, and loss of limb if you are not doing having two of those other things. And so some people are calling it the aspirin of the rich. All of this is actually it's retrospective data, which is not level 1, but we do know that it's good. They're good for you. So, and it's not just for older people. I've got guys who have type 1 diabetes, which has started in their early youth, and they have erectile dysfunction. Works like a charm for them, and you don't get addicted to them. It doesn't make you want to have more sex. It's not going to force you to go and have sex, and it's not only going to help in erection if you feel sexually stimulated.
So what do you mean when you say it helps with an erection? Does it make it stronger?
It can improve the strength of the erection. It can improve the chances of getting the erection. It can also shorten the period that we were talking about between where you ejaculate and get another erection. That's not what it's really indicated for, but the point is that it can help with that as well. So it's not a wonder drug, but it is super helpful.
All right, Nazir, you're calling us from Lenasia. Good morning.
Morning. Hi. How are you?
Hi, I'm good, Nazir. Go ahead.
Hello.
Hi, Nazir. We can hear you.
Yeah, I got a little. I take very little ejaculate, right?
Yeah.
And sometimes I even make my partner tired, and then suddenly the feeling goes away. It's a problem.
Okay.
Yeah.
So you take long to ejaculate, yeah, Nazir?
Okay. Yeah.
Yeah. Unfortunately, your problem is a little bit more complex than the one that is far more common, which is ejaculating too quickly. Remember the amount the ejaculatory time is based a lot of different factors, but the one that's most important is there's a chemical in the brain called serotonin, which is if it's low, it causes you to ejaculate too quickly, and if it's high, it can cause you to have delayed ejaculation as well. And the commonest, and it's sort of a catch-22, but the fact of the matter is that if you have premature ejaculation, there are lots of things we can do, but the one that is an off-label treatment where we use forms of antidepressants called SSRIs, or serotonin reuptake inhibitors, which raise the serotonin in the brain. And if you are taking an antidepressant, you're going to have delayed ejaculation as well, even if you didn't want it.
No, I'm not taking no medication.
No, that's fine.
I'm
Yeah.
a heart patient now.
Okay.
And you're 56, so still young.
Still a youngster.
I'm 56.
Yeah, you're a young man. I would say if this has been going on for a long period of time and it's really bothering you, usually we need to do what we call biofeedback, which is using psychological methods to make you start being able to get to the point where you can have orgasm. Because we know if you're not on medications and you don't have anything that's causing the raise in serotonin in the brain or some other things, it often is related to the intimacy and how you intimate with your partner. So I think I would advise you to go and see a sexual therapist. who can then discuss it with you a bit more. But as I said, the premature ejaculation, which happens to about 80% of guys, and your situation is probably in about 3% of the population. But in the 80% who have premature ejaculation, just going to your GP or general practitioner should be sufficient. They can help you with this as well.
All right, great. Nazir, have it checked out and all the best. Albert in Houghton, hi.
Good, Clement
Sure.
and team. How are you?
Sure, and go ahead.
Yes. Clement, I just need to ask, there's some herbal we are getting, and so I just sort of, whatever like that, and is it has no side effect after when maybe I don't want to use it, I stop using it. I just need to know that.
Have you used it, Albert?
Pardon?
Have you tried it, Mpesu?
Yes, I did.
And?
No. It's okay.
Okay.
But I just need. I keep on using it. It might have any
Side effects. Okay. Worried about the side effects.
Okay. Yeah, I think when we're looking at any of these therapies, and why I was even mentioning the PD5s that they're so super safe, is that we need to make sure safety. Safety is the most important thing when it comes to anything that we're using in our bodies, I would say. And that's why as a medical practitioner and as a scientist, I need to base it on data. I'm not saying that a lot of these things that are over the counter or M-Pesos are not good, but the point is that we haven't got great data for it. But M-Peso for me particularly, because my mother did her PhD on this, I do have some good data on that. For our purposes, there are three types of erections. There's the psychogenic, the one that everyone thinks about, and we feel like having sex, and it sends a signal down to the penis, and you feel like having sex. Second is what we call nocturnal, which is where we get erections at night. That's mainly just to increase oxygen into the penis. And it's not
when you wake up?
Yeah, you usually get, it depending on the age, but for a 1-year-old and newborns, they're getting between 12 and 15 erections every day. Yeah, more than you and me, my friend. But it's just for oxygen into the penis. It's normal. And mothers, please leave the guys alone. They fiddle with it sometimes.
They're not naughty.
They're not naughty. It's what they should be doing. Okay, and that's based a lot on the so-called man chemical testosterone. The third one is what we call reflexogenic, which is a reflex. For example, paraplegic men. They can get erections if they pinch the tip of the penis or the inside of their anus because it causes a reflex, sort of like the knee jerk that people have. And you can get 70-80% of them get erections that can have sex. And their bigger problem is usually fertility. And what M-Peso does is that it's actually a toxin. It contains mainly something called cantheridine. And it's not just M-Peso. These Spanish flies, all of them have very similar chemicals. What it does is it causes irritation to the skin coverings of your stomach, skin covering of your kidneys, skin covering of your bladder, skin covering of the pipe for passing urine as well. And because of that, it can cause a reflex erection because you're irritating your pipe for passing urine, okay? It can work. Obviously, is evident, but the problem is that because it's damaging, it's going to other places like the liver, the kidneys. You can get liver failure, you can get kidney failure, you can get heart problems as well. So I'm not saying don't take it. A person must make their calls. But as far as I know from the data, I would not be very comfortable about using it myself. Yeah. And if I'm not comfortable, I wouldn't tell somebody else to use it.
All right. Yeah, some WhatsApp voice notes that have come through.
Hi, Clement, Anonymous here. My question, I always hear about supplements. I've actually been to my doctor. I've asked for supplements. My doctor said no, he won't give that to me because apparently there's some dangers associated with testosterone supplements. In my case, I inquired about it because of depression. Thanks.
Great. So,
we'll come to that. Let's hear another one.
Okay.
Morning, Clement. Here, I'm 61, but I know, actually, as many people say, I look between 45 and 50 while I gym the whole of my life. I'm fit and coming to between the sheets, I hit all the corners. Yeah, just wanted to know, not sleeping enough do affect libido or erection. Can the professor elaborate more on that, please? Thank you.
Hi, Clement. How safe is penis enlargement procedures after 50. May you please find out from the doctor there. Thank you.
Okay. Let's take those first three. The supplements, not sleeping enough, and penis enlargement procedures.
Thanks for writing it down because I'm getting forgetful with my low testosterone. Anyways, the point, the testosterone, the short answer for him, the data was all over the place. We used to say that no testosterone is going to cause you problems, this, that, the other. The reality is that we now have level 1 evidence that it is super safe for the vast majority of people. The trial called the Traverse trial, it showed that there was no increase in cardiovascular events. There was no increase in prostate cancer, which a lot of people were. In fact, it looked like there was a bit of a decrease. And remember, this trial we actually super selected patients who are at cardiac risk. Very safe, provided you're doing something which is taking it parenterally, which means that it's not going through the liver immediately, because that the ones that you buy over the counter called testosterone boosts and things like that, they can't really contain testosterone, because if they had testosterone, they would cause damage to the liver, causing to get clotting and stuff like that. But if you get it as a patch or an injection, or there are some tablets, but they don't work through they don't go through the bloodstream, they go through something called lymphatics. You can help. It's very good. So I think you must just talk to him and maybe just ask him for a second opinion to somebody who's interested in sexual health.
Okay. Not sleeping enough?
Not sleeping enough. Insomnia, sleep problems, big issue for everything, including decreasing your testosterone, decreasing your erections. Obstructive sleep apnea, which OSA, which is a big name for our purposes of people who snore a lot and stop breathing, often related to obesity and overweight, which is a medical condition. Please let's not fat shame people. They must get through therapies for it. But the testosterone, it can go down. Your libido can go down. You can get erectile problems because of that.
Okay.
Penile enlargement. There are only 3 ways you can increase your penis size, not by creams or things like that. One is by regularly using it. Second is by
regularly using it.
Yeah. The more you use it, the less you lose it, basically. So if you're having because you need the oxygen to go into the penis, okay, but not for too long. The second is if there are some devices where you can use which look like braces for the penis, and they just stretch it. You have to wear it for quite a long period of time per day, and it's quite bulky, but it does help. And we're usually using it for patients who have tremendous bends, but not really for enlargement, but it can. The third one is to do an operation, and the operation basically entails us. About half of the spongy tissues are buried underneath your bone in front there. We can cut a ligament there, pull it forward, inject fat around it. It looks longer when it's not erect. It doesn't really work. But I can tell you, of all the operations, I tell my residents, never do the operation, because of all operations in the whole of medicine, the most sued operation is the penis enlargement, because your penis is generally fine, guys. Relax. I mean, take it easy, but if you want to go for that operation, I would not do it for you. I've only done about 8 in my whole career, and that's 35 years.
Shoo. All right. Okay, let's take a quick break. It's 12 minutes now before 12 o'clock. Phineas, I see you. I'll start with your call after the break, and then we'll have some more WhatsApp voice notes.
Hating the corporate 9 to 5? Get covered at pineapple.co.za. It's easy and like 19 Rand a day. So it's 100% the insurance for you. Underwritten by Old Mutual Alternative Risk Transfer Insure Limited, a licensed non-life insurer and authorized FSP. Premiums are risk profile dependent.
The unexamined life is not worth living. Socrates' timeless wisdom reminds us of the power of introspection. At Plus 94 Research, we delve deep into data, uncovering insights that drive meaningful decisions. Our scientific methodologies transform questions into clarity. Don't just operate, understand. Don't just guess, know. Plus 94 Research, the science of decision making.
Relationship issues?
Relationship talk.
On 702.
At 9 minutes now, before 12 o'clock, let's go straight to your WhatsApps and your calls.
Good morning, Clement, and the doctor there, and all the listeners. I'm Maxwell. I'm listening to your show. It's very, very interesting. Thanks to the doctor there. My issue is that I'm 52 and I'm dating a young, beautiful woman. She's 38. And she just loves and enjoys and adores sex. And when it happens, it's quite fun, very nice. It goes on and on and on. But my real concern is, as I age, and she's like younger do I need to get worried? Because not always I want to be intimate with her, yet I found a way of saying to her, it's not really about, sex. It's about everything, cuddling, talking, and everything. So my real concern is, as I age, wanna get stuck. Thank you.
Hi, good morning, Clement, and your guest right there. Does your penis shrink when you get older? Does a penis shrink? Thank you.
Yeah, I think you had already addressed that one.
But I'll just address it a little bit more. Guys, everybody looks at, we watch too much various things on the internet. The average porn movie, for example, takes between 2.5 to 5 days to make. They're not lasting for error and error. And on top of that, I'm sure they wouldn't Photoshop. Of course they're Photoshopping these things. Fine, there's a bell-shaped curve. There's a part, some people will be bigger than others. But in general, you're not, especially when you go like to the bathroom and you're looking and checking each other. First of all, the guy's not erect, usually, I would hope, unless there's something, unless it's something swinging. And second of all, the penis is going to get much bigger when it gets erect. Second of all, if you know physics, the angles that you're looking at, everyone is going to look bigger from the angle that you're looking at. Relax. Unless you're having sex in the bathroom. Mile High Club, I'm not sure about you, Clem. I'm not going to mention it too much. But the point is that your penis doesn't shrink just by itself as you get older. It's a matter of the way you think about it as well. And that brings me on to the first question. I think there are two aspects that you need to remember. First of all, you must stop worrying. Stress. You're already thinking of a problem before it even occurs. It doesn't have to occur. You just continue living your life and doing what's necessary. But the second is probably even the most important thing when you're in a sexual relationship with somebody. Communicate. Communicate. You have to explain to them what's going on. Each of you will change as you go along. If you're female, male, if you're in a non-monogamous relationship, if you're in a non-heterosexual relationship, everything changes, but you have to have the communication with your partner, because the biggest sex organ is the brain. Just talk to your partner, but don't be stressing yourself about it. There will be changes in everything.
Phineas in Krugersdorp, hi.
Hi.
Sure, go ahead.
Hi, Doctor. My problem here is I'm 70 years old, and I do have a high blood pressure as well as diabetic. About a year ago, I started losing erection for more than 5 minutes. And it's coming down like that, and I don't know where can I actually visit Dr. Shingai then. And maybe because my doctor gave me some other tablets, and they seem to be not working.
Okay, got it.
Yeah, I think the first step is that there's so many people who can work in this. Lots of healthcare providers. Your GP is definitely the first person to go to. If you do need advanced, you can always find a way to go. But my main job is at a university government hospital, so I that's where I work most of the time. So I would say that if you do talk to your GP. If he's not comfortable going further, then go ahead. Just do remember one small thing though, is that the diabetes is a big issue, because the guy asked about testosterone earlier. We know that diabetic men, about 90% of them have low testosterone. It can impact on their improvements of diabetic control and various other things as well. And on top of that, there's even evidence to show that these new drugs for the weight loss can also help with that as well.
Okay, Charles says, hi Clement, I'm 60 and for reasons not relevant, I'm having sex again after a drought of about 10 years. I'm taking enhancements pills from a reputable adult store, which keep me erect. My problem is achieving orgasm though. Sex feels great, but the sensation doesn't build to the point I go over the edge. Is this because of age? Are there any creams or lotions that can increase sensitivity on my penis?
The short answer is there's no good evidence for that. I think, again, you need to get to the core of the issue, and that's going to be the brain. You have to assess what's going on. Remember, if you're also, I don't know which supplements he's talking about, but they're the injectables, there's the tablets and various other things. The injectables will stay erect even after you've had orgasm, so that might be one of the issues. But I would say he must go and talk to his GP and find out what's going on.
Last one from someone who says, "Hi Clement, can the doctor please give some nutritional advice to maintain a healthy penis and testosterone? And are Kegel exercises beneficial, and do they work in terms of strengthening the muscle around the penis?"
Any form of exercise, including Kegel exercise and any other type, will strengthen those muscles. The first part about I've forgotten already. You see how my testosterone level is so low. What was the first part?
So the first part, where's that? Okay.
It's diet. Yes.
Diet.
Yeah. The short answer again, standard. It's about quantity and quality. Quantity, decrease the numbers of calories, particularly high fructose sugary things, which is not just from Cokes and things like that. It's also from fruit juices and stuff. Be careful with those. Decrease those numbers. The second is the quality, because we know obesity is huge amongst the poor more than the rich, mainly because the quality of the diet is poor. Highly processed foods, try to cut them out.
Dr. Shingai, you're always great. Thank you so much for making time for
the
us.
opportunity, and thanks to the listeners.
It's 2 minutes before 12.
Okay, truck 7 at zero warning lights. Truck 8, it's just been serviced. I guess we're running like a well-oiled machine. Where would I be without My Way's comprehensive cover for my vans and trucks?